I'm Kevon Owen, and a lot of times people call us and they'll be looking for somebody. They'll be looking for somebody. Hey, are you a psychiatrist? Jack, are you a psychiatrist?
No, I'm not a medical doctor. And that's what a psychiatrist is. A medical doctor who prescribes medicine.
Psychotropic meds specialized for dealing with chemicals in the brain. Now, sometimes people will say, hey, you're way better than my old psychiatrist. Well, why do you say that? And then they'll follow that up with, well, you spent a lot more time talking to me. Well, my job as a Christian counselor and clinical psychotherapist is talking to you, seeing where you're at, seeing how you can overcome barriers and obstacles. So if you talk to a psychiatrist and all they did was talk to you about symptoms and then write your prescription, well, yeah, that's what they do. They're a doctor. They write scripts. Scripts don't solve life's problems. They help you to overcome physical symptoms. Jack, what is a clinical psychologist?
A clinical psychologist.
APA, board approved.
Yeah. You're actually diagnosing problems and you're helping people with symptoms, writing treatment plans and things like that.
Testing.
Yep, testing.
Testing for court stuff would be good. Testing for like what parts of the brain are functioning. They can do counseling, but to think as a generalized rule, they have a different function. Now, if you're doing anything involving courts, if you're doing anything involving diagnosis of major functional disorder, you need a clinical psychologist. Now, if you need someone to talk to about life's problems, maybe your interactions aren't going the way you want them to go, who's that?
That would be a counselor.
That's a counselor.
Yeah.
Jack and I are counselors. We're both Christian counselors, and we would love to talk to you about helping your kids learn to thrive, or
Helping you learn to thrive.
helping you learn to thrive. Maybe working with your relationship, seeing what's going on there. Now, if you need a clinical psychotherapist, that's somebody who diagnoses and treats mental health issues without medication. So if you were having anxiety and it was causing you an issue, or you were depressed, it was causing you an issue, hey, that's us too. We're clinicians. We treat depression and anxiety. We can do treatment plans and that kind of stuff. So that is what a clinical psychotherapist is. That is what a counselor is. Jack, what is a Christian counselor?
A Christian counselor is the same thing as a counselor, except we're able to. We have a different set of ethics. We're able to use the Bible as a template to help us with our problems. There's so many things in the Bible that talks about mental health, physical health, relating to others. It's the user's manual for the human being, and we're able to use that as Christian counselors to be able to help you with your issues and your problems.
A lot of the things that you bring into counseling have to be influenced by a biblical worldview. Well, let me say it like this. They're being influenced by it one way or another. Now, are you doing it on purpose? That's a good question. Now, there are times when we work together. Oftentimes, Jack and I can diagnose very well. It's part of our license, it's a part of our training, but every now and then you'll run into something that could be this or this or this. In that case, we refer out to what we call a clinical psychologist who would run tests, give us answers, that kind of stuff. So if you're thinking, hey, does my child have a processing delay, or is this ADHD, is there something along those lines, and their diagnostic criteria is blurry because not everybody fits into a category in a book, then we might refer to a psychologist. Now, a psychologist may come up with results, and those results may say, hey, you need a counselor, or those results may say, hey, you need a psychiatrist.
Yeah.
If you're prescribed medication, I don't know many prescribers that don't follow up medication with check out a counselor, because once again, medications treat symptoms, not life's problems. And the goal isn't to be on medication for the rest of your life if it can be avoided.
Yeah, that would be the same as taking a bunch of supplements and creatine and weight gainer and protein and all this stuff and not going to the gym. It's like you can take the medicine, that's a boost, but you still need to put in the work as well, and that's what's sustainable.
We have prescribers that we work with in our office. We work closely with psychologists. We are trained in psychometrics, which means we can do some testing. Some testing we can't do. We certainly can do counseling for children, for teens, for adults, for couples, and for families. So if you're looking for any of those things, that's what we do. Hopefully this helps, because there is a lot of gray area, and there's a lot of overlapping And there's a lot of times we just don't know what it is that we need or what it is exactly that people's jobs are. When you come in expecting one thing and you don't get it, wow, that can be frustrating. So just to clarify, just to help, if you're looking for counselors, clinical psychotherapists, we can help. If you're looking for a psychiatrist, well, we know people. We know people who write scripts. We'd love to help you find the resource that you need.